y'all so much for having me here. Oh my goodness, y'all came out today, and I'm so excited for that. So, my name is Lovey Baxter. I am a nurse practitioner as well as a master's level social worker, and I take care of senior citizens. That is my sweet spot. Geriatrics has always been my passion, and so I spend a lot of time talking to churches, community centers, senior centers about how to plan to get older, what to do so that you are not operating in crisis mode when you get to this age, because it is expensive to get care, right? And the way our wonderful insurances are set up, they're not always user-friendly, right? So I like to talk to senior crowds to give you some just tidbits and just jewels so that you can put them into play and hopefully have a smoother transition to when you may need care in the future. Because the goal is to get older, right? So we want to do it gracefully, we want to do it comfortably, and we want to make sure that you get the care that you deserve. I own and operate a Touch of Love residential care homes. Those are homes in the community like you probably live in now. But on the inside, what you're going to find is about 3 senior citizens living there. And my staff and I have the privilege of taking care of them, okay? So that's all this stuff over here that you see, all the stuff up here. I recently started a podcast. That podcast talks about it. Things like we're going to talk about today. How to go to your doctor's office and get all the information you need to get in and talk to them like in 15 minutes. Because as physicians, that's what we're held to. Our insurance company wants us to get in there, talk to you about your problem, write a prescription, and get you out the door in 15 minutes. Now, you all know that is crazy, right? But it's what we have to do. So I want to give you tidbits on how to operate in that, what you need to say, how you need to say it, so you can get the stuff taken care of that you came there for. So today, we are going to talk about preventing crisis before it starts and getting healthcare professionals to actually listen to you. Okay? So, independence is fragile when nobody is planning to protect it. I'm not here to scare you. I'm here to empower you. Again, the goal is to remain independent as long as you can. The goal is to live well. The goal is to live safely and on your own for as many months, years as you possibly can. So, a crisis does not start with a 911 call. A medical crisis almost never begins with sirens. It begins as a whisper. It's the little comments like, I feel a little off today. I'm just more tired lately. I don't have much of an appetite. I'll be fine. How many people have said that? Oh, it's nothing. I'll be fine. Many active seniors push through symptoms because you're strong, you're resilient, and you're used to taking care of yourself. Now, the problem with that is pushing through can sometimes hide those warning signs. So, changes in balance. Walking around and you kind of, oh, all right, well, I just lost my footing that time. And you kind of brush it off. Changes in sleep. I didn't sleep well last night, then the next night. I didn't sleep well last night. And it just kind of snowballs and it continues. Changes in memory. I have this myself. You're able to remember some things. You walk into a room, can't remember why you came there, right? Right. Everybody can agree to that one. Whew, that one's rough. Changes in energy. Well, I just don't feel like getting out the house today. I'm just going to stay in. I'm tired. Changes in your mood. Usually you're upbeat and happy, and you're noticing that you're having more, downtimes, just not feeling your best. These are not always just aging. And I hate when my fellow medical professionals say, well, you're getting older. You're supposed to be tired. You're supposed to be. No, you don't have to be. That's not the norm. Your body whispers before it screams, okay? So here's another truth. Many seniors do not want to bother anyone. Everybody probably can raise their hand on that one. I don't want to bother my daughter. She's busy. My son works a lot. They've got 4 kids, you know? You don't want to worry them. You don't want to lose your independence. That's a big one. And you don't want someone, here we go, drum roll. Ray, where you at? Give me a drum roll. You don't want someone telling you what to do. I get it. I get it. But the silence can be dangerous, okay? Not wanting to be a burden can become the biggest burden of all. So the red flags that active seniors ignore, let's talk about some of those. Even if you say you feel mostly fine, the physical changes, feeling weaker than usual, new or worsening balancing issues, losing weight without trying, sleeping much more, getting winded easy. Walking from here to the parking lot is a good trek. You used to be able to do it, but now Jesus, I'm tired. Those are signs. And then the one that I do not like, falling. Falling or almost falling, y'all. I know sometimes you may think, I didn't fall, so I'm okay. But you almost fell. Why? Why did you almost fall? Near falls are warning signs. Actual falls are consequences. Okay? Cognitive changes. Let's talk about this. We had an appointment Monday morning, but we forgot. Losing track of medications. I forgot to call it in and get a refill. Or I just forgot to take my noon medications. It's only one. It won't matter. Repeating stories. Did I tell you that my son and daughter-in-law just had a baby? You told me 5 times. We're ready. We're happy. When is the baby coming? Trouble following conversations. What are they talking about? What did they say? I don't understand what they're saying. Getting confused in familiar places. I go to this place every single day. Now Walmart. Now I can't figure out which way was the bread aisle. Okay? This is not about labeling you. It's about protecting you. Emotional changes like withdrawal from activities, increased anxiety, irritability, and loss of motivation. All of those are signs, okay? Isolation accelerates decline faster than aging does. I'm so proud to see this room packed. I deal with senior citizens every single day that they are in their house and nobody comes to visit. Nobody stops by to say hi. And that will make you decline so quickly. There's a reason why we're supposed to have human interaction. Why do doctors sometimes miss what you're saying? So now we're moving to where we're at the actual doctor's office. Let's talk about the part that nobody explains, okay? As I mentioned to you all earlier, healthcare providers are not ignoring you on purpose. There's just, healthcare is now run by insurance companies. Yes. It's not about you as the person, and as a healthcare provider, I hate talking about this, but I talk about it because it's real and it's factual. And I might be employed at the YMCA because I'm saying this, but it's true. Might have to get a job up here. Can you hook me up? Okay. So healthcare professionals are not ignoring you on purpose. They are busy. The appointments are short. They rely on clear and concrete information to make a decision, to make a diagnosis, and to prescribe medication. So it's really probably a whole lot reaching, to say it nicely, to say that, oh, we can just change that. We can just tell the insurance companies to da-da-da-da. That ain't happening. So that's a stretch, right? So we want to figure out how we can be equipped when we go into that doctor's office. What do we need to say? What do we need to do? So I want to give you some cliff notes or cheat sheets. If you say, I'm just getting older, they may take you at your word. But if you say, I have fallen twice this month and feel dizzy every morning, that's a big difference. Now you've given me what I need to know and I can act on that. Okay, you see the difference? Vague symptoms get vague solutions. So we don't want that. Many seniors also minimize problems because you don't want the test, or you don't want additional medication, or you definitely don't want any restrictions. I get it. But you have to be clear and concise. Your health is worth it, and you are worth paying attention to and knowing what's going on with you. So you might say, it's nothing, it's not that bad, I don't want to make a fuss. How many people have said that before? I'm guilty of that, right? But if you soften the problem, the response will be soft too. You cannot get serious help for a problem you describe as small. There is also fear. I understand that. You have fear of losing your driver's license, right? Fear of losing, being independent. Fear of being told, what's the big one? Drum roll. You cannot live alone. So you say less than you should, but you got to change that. Information withheld from independence can cost you your independence. So how to make healthcare professionals listen? This is where you gain your power. You want to speak in specifics. Instead of saying, I don't feel well, we want you to say again, I feel dizzy when I stand up, and I nearly fell yesterday. That gives me so much to work with, and I can meet that 15-minute deadline when you give me that information. And plus, you're taking charge of your health. Instead of just saying, I'm tired, you can say, I'm sleeping 12 hours a day and I still feel exhausted. Well, that's a problem, right? Specifics. Specifics turn concern into action, and that's what we want. You want to use phrases that signal seriousness. You can say, this is new for me. This is not my normal. I'm concerned about my safety. I live alone. What should I do if this gets worse? All of those will trigger your healthcare professional to, we got to take control of this. They're invested in their health. I'm not saying that every healthcare professional is not concerned, but when you are seeing people and you're seeing 35 to 40 people a day, and somebody comes in there with just vague, dismissive symptoms, you don't have to be Scooby-Doo to figure out what I'm going to say. They're just going to be like, okay, well, we'll make another appointment for you. We'll look at that later. No, we need action today. Those statements communicate urgency without panic. The next thing you can do is bring written information. We already talked about our memory is going. Okay, let's fix that. Bring written information. When something happens to you, write it down. Get your little notebook, keep it in your purse. On this date, almost fell going from the garage to the kitchen. Bam, put it in your purse, put it in your wallet. That way, when your appointment is in 3 weeks, you can flip it out and say, okay, on February the 3rd, this is what happened. February the 7th, it happened again. And that way you're not trying to remember when you're pressed for time, because you know what your doctor's doing this. Am I telling the truth? And sometimes that can be very intimidating because they're going to cut you off. They're going to ask you a question. Well, what about this? And you're going to be like, well, wait a minute, I didn't even answer that one. But if you come equipped with your stuff written down, you can play the game that insurance has us playing. Memory can fail under stress, even for the sharpest minds, okay? So just because you're writing it down doesn't mean that you got early onset dementia. That's not what I'm saying. I'm just saying learn how to play the game. The game is 15 minutes. So let's write down our stuff and be organized, okay? Bring your medication list, symptom timeline, questions, and of course your medical history. Prepared patients get taken care more seriously and faster. That breaks my heart to have to even say that, but I'm not here to sugarcoat stuff. I'm here to tell you the truth so you can be better at managing your health. Prepared patients get taken care of more seriously and faster. So what does that tell you? You got to be prepared. Bring a support person when needed. A trusted friend, an adult child, a neighbor, an advocate. I spend a lot of time. I own my own business, but on the flip side of that, guess what I'm doing? Going to specialists. Because if one of my patients that I take care of, if they have a specialty doctor that's outside of my scope of practice, let's say an oncologist, cardiologist, rheumatologist, something like that, where I don't specifically take care of that, sometimes when families are too busy, they will hire me to go to that doctor's appointment. And you know the doctor's face is like when I walk in. I don't walk in with my lab jacket on or anything, but the moment I open my mouth, they know I'm here to advocate for my patient. I call them my loved ones, My name is Lovey, go figure. I'm always spreading love. But yeah, I'm there to advocate for them and make sure that they get what they need. And so they won't be any dismissiveness those days when I'm there. It shouldn't be any time, but sometimes it is, right? And I'm not saying all healthcare professionals are bad. I'm not saying that at all. I'm just saying that it is difficult to manage symptoms, prescribe, diagnose, and all of that in the restraints that our healthcare system runs under. So not because you're weak do you need those things that I listed or those people, but because two sets of ears and eyes are better than one. I don't know how many times, even now, I have to ask my children, what did they say? Did they say this? You know, because you forget, and when you're taking in so much information, it can be hard. So prevention that protects your freedom. If your goal, which I'm assuming everybody in here, because y'all are already movers and shakers, which I love. So if your goal is to stay independent, prevention is your best tool. That means we don't want to be reactive. We want to be proactive, right? I don't want to talk to you after you've fallen and broken your hip. I will. But what can we do ahead of time to put measures in place so there's no falls or there's no whatever the situation is? Regular checkups, medication reviews, that's something else that I do a lot. I'll get a patient into one of my care homes and they are on a slew. I don't even know if that's a word, but I make it up and I use it a lot, so meaning a lot. A slew of medication. And I'm looking at it and I'm like, why are you on 4 or 5 hypertensive medications? That's a lot. Why are you on 3 different, cholesterol medications? It may be that it's needed, but a lot of times it's because you went to this doctor and then that doctor went out of business or whatever, or you just didn't like them. So you went over here to this doctor and there was no communication in between the two. And so you went in with the problem and you just got prescribed another medication, and so you're doing what your doctor said. You're taking your meds, right? It happens. So medication reviews, vision and hearing tests, balance assessments. Those are important, y'all. Home safety improvements. Those are important. What can you do in your home to make it safer? Number 1, get rid of all your rugs. Y'all's generation loves rugs. I know. My grandmother almost stopped talking to me when I told her, we got to get rid of some of these rugs. I call her Goosey. Goosey, these rugs are making you, almost fall. Then have an emergency plan. If something were to happen, what do you need to do? I talk again to a lot of families, and the majority of them come to me when it's crisis mode. Mom fell, and now she's in rehab. Let's not even make it dramatic. She didn't break her hip, but she got hurt pretty bad. So she's doing her therapy in rehab. Now, rehab is saying because of that fall, she cannot go home alone. And now we've got to scramble to figure out what the plan is, how we're going to do it. She was living by herself. The kids are both working full-time with their own kids, right? So let's try to have an emergency plan in place. And the biggest thing that I see with families is they don't want to talk about this. We plan for graduations, births, quinceañeras, retirements. We plan for everything but the one thing that is going to happen. If you are born, you are going to pass away at some point. And a lot of people don't want to talk about that. And I know it's hard, but I promise you, if your daughter and your son knows mom wants to be cremated, dad has his plot already at ABC Cemetery. He doesn't want a big funeral. He just wants a memorial service. It's so hard to have those conversations, but it makes everybody's life so much easier when it's that time, okay? So having those hard conversations. And remember, small changes now prevent big losses later. Grab bars do not mean that you're fragile, so those are good things to do as well. And asking for help does not mean that you're giving up, whether that's asking for help from your children or your neighbors or whoever your trusted person is. or if it's bringing in professionals like myself. Safety devices protect independence. They do not threaten it. So your walkers, your wheelchairs, your canes, all of that stuff helps keep you moving. It's better to have that than to not have it and you fall and now we're dealing with a broken hip because pride got in the way and you didn't want somebody seeing you with a walker or a cane or a wheelchair. Ray, be quiet over there in the corner. So here's a big one. Staying socially connected. Everybody in here, I've never desired to be a teacher, but if I was a teacher, everybody in here would get an A+. Because y'all are here, you're present, you signed up for this class, you made an attempt to be here. You're staying connected. That is so crucial. People who stay engaged decline slower. They decline slower physically and cognitively, okay? Community is preventive medicine. Again, we want to be proactive, not reactive. Staying close together. If somebody knows that you struggle with something, 9 times out of 10, either they're struggling with it or they know somebody who has, and you can pull your brains together and figure stuff out. So let's talk about the cost of waiting, because I'm here to make sure that you know your pros, your cons, the good and the bad. I have seen too many people say, and they say this to me all the time, I wish I would have done something sooner. Lovey, I wish we would have found your care home sooner. I wish I would have known about your services sooner. Because one crisis can change everything overnight. One fall, and I tell my patients all the time, one fall changes your trajectory from here on out, even if it wasn't a bad fall with the break. That's trauma to your body if you fell. And it changes. Loss of mobility, loss of confidence. How many people have fallen and that's what they are so afraid to do from here on out? So they're just constantly. And you don't have to be old to go through that, right? Loss of independence. Loss of ability to return home. Yeah, you can't live by yourself, so now you got to come live with me, which is not really a bad thing, but it's something that could happen, right? Independence lost suddenly is rarely regained quickly. Sorry about that. Independence lost suddenly is rarely regained quickly. Oh, I got an amen on that one. I love that one. Okay, so let me wrap it up with this, y'all. You have worked your entire life to build independence that you enjoy today. You have to protect it. You deserve to keep it. Okay? Independence is not maintained by denial or pride. It's maintained by preparation. Strong people do not wait until they are in trouble. Strong people plan so they never have to panic. Planning is not giving up independence. It is defending it. Okay? You do not have to move. You do not have to give up your life. You do not have to wait until something bad happens to make sure that you are having all of the things that you need to in place. Support can come to you. Part of my services are people leave their homes, come and live in one of my homes in the community and live with other seniors. But also, like I mentioned earlier, I go into people's homes. You need somebody to go to the doctor with you? I can be hired to do that. You need somebody to come and look at your medications, look around your home? Lovey, what will it take for me to stay in my home as long as possible? Let's get rid of them rugs. And whatever else I'm seeing, I'm going to tell you. And you can ask my beautiful assistant over here. I do not sugarcoat well. So sometimes those conversations are hard to have, but you need somebody who's going to do that for you. So through Love in Action, which is my program that I come into people's home, and then A Touch of Love Care Home, which is my business where people come and live, my team and I help seniors stay safe, supported, and in control. And that's the biggest thing. You want to be in control of your life. You don't want somebody else telling you what you got to do, when you got to do it. Whether that means help at home, medical coordination, transportation, or planning for the future. Because the goal is not just to live longer, the goal is to live well and live safely.
Amen.
And because, that's 2 amens, I hope y'all keeping track. And because so many families and seniors told me they wish they had this information sooner, that's why we had you all at the front. But when you came in, subscribe to my podcast. These are things that I talk about. I go through an array of different topics to help you say, oh, well, I didn't know that. Oh, I never thought about that. I didn't know those services were available, because you don't know what you don't know, right? I make sure that my podcast is practical, it's honest, and it gives you the information you need before a crisis forces decisions you're not ready to make. If today helped you in any way, I encourage you to follow up with me. I've got all kind of information up here about both my residential care home. If you scan the QR code and subscribe to my podcast, you can follow me like that. I'm all over social media. You can always follow me there, and you can figure out Lovey. I call it being in these streets. Lovey's in the streets again. She's going to be at the senior center. She's going to be back here at the YMCA. She's going to be at this church down the street. You can come and stalk me and be with me and learn whatever else that I may be covering that day. Are there any questions about what I went over, or any comments or anything that you all would want to add? Yes, ma'am.
Your facility, is that for temporary?
So my homes are designed to age in place. So I do take care of patients who just want to rehab, meaning you come from surgery and you just can't go home, but the goal is to get you stronger and then go back home. So I do that. But the majority of my patients cannot safely stay at home anymore. So they move into one of my homes and we take care of them, and then they age in place.
Thank you. Thank you. Thank you.